Welcome to our educational series on incorporating clinical knowledge and guidelines into practice. In this video, we'll explore the significance of clinical knowledge and the role of guidelines in enhancing patient care. Clinical knowledge is the foundation of effective healthcare, encompassing information and skills from medical education and practice. This includes evidence-based research, clinical experience, and patient interactions, all crucial for informed decision-making. Guidelines, on the other hand, are systematically developed statements that assist practitioners and patients in making decisions about appropriate healthcare for specific clinical circumstances. They bridge the gap between research and practice, providing a structured approach to patient care. By integrating these guidelines into everyday practice, healthcare professionals can ensure they are delivering the best possible care. Throughout this series, we'll delve deeper into the aspects of clinical knowledge and guidelines, providing practical examples and tips on how to successfully incorporate them into your practice. As we move forward, you'll see detailed explanations and real-life examples to help you navigate the complexities of clinical guidelines and their application. Let's embark on this journey together to enhance clinical practice and improve patient outcomes. Welcome to our series on incorporating clinical knowledge and guidelines into practice. Let's dive into understanding what clinical knowledge truly entails. Clinical knowledge encompasses the information and skills acquired through both medical education and hands-on practice. It forms the foundation of effective patient care and is derived from three main sources. First, evidence-based research provides critical data that supports clinical decisions. This research includes peer-reviewed articles, clinical trials, and systematic reviews that offer insights into best practices and effective treatments. Second, clinical experience is a crucial component. Over time, healthcare professionals gather invaluable insights and practical know-how from direct patient care, learning from successes and challenges alike. Lastly, patient interactions play a vital role in enhancing clinical knowledge. Through dialogue and observation, practitioners gain a deeper understanding of individual patient needs and how to tailor care uniquely for each situation. Understanding these sources enriches our approach to healthcare, enabling us to provide better and more informed patient care. As we move forward, you'll see how these elements come together to shape the role of clinical guidelines in practice. Welcome back. In this segment, we're diving into the role of guidelines in clinical practice. Clinical guidelines are systematically developed statements that assist practitioners and patients in making decisions about appropriate healthcare for specific clinical circumstances. But what exactly does that mean for daily practice? Guidelines are essential tools in the healthcare arsenal. They help standardize care by providing recommendations based on the best available evidence. This ensures consistency and improves overall patient outcomes. For healthcare professionals, adhering to guidelines can offer a roadmap for treating common conditions and complex cases alike. Beyond just providing a framework, guidelines also foster a deeper understanding of the latest advancements in medical science. They bridge the gap between clinical research and real-world application, ensuring that patients receive care rooted in the most current, evidence-based practices. As we move forward, you'll see how integrating these guidelines into your everyday practice can streamline decision-making and enhance patient care. Stay with us as we explore practical steps and examples of applying these critical tools in the next segments. Integrating clinical knowledge into practice requires a multifaceted approach. First, healthcare professionals must stay updated with the latest research and evidence-based practices. This involves continuous learning through medical journals, seminars, and professional development courses. Secondly, it's crucial to apply this knowledge practically, tailoring interventions to fit individual patient needs and contexts. However, integrating clinical knowledge isn't without its challenges. Time constraints in busy clinical environments can limit opportunities for in-depth study and application. Additionally, the sheer volume of information and rapidly evolving medical advancements can lead to information overload, making it difficult to discern and prioritize relevant updates. To overcome these hurdles, developing efficient strategies is essential. Utilizing digital tools and collaborative learning platforms can streamline the process, ensuring that critical information is accessible and manageable. Peer support and mentorship also play significant roles in bridging the gap between theoretical knowledge and practical application. We will provide practical examples and effective techniques to help you integrate clinical knowledge seamlessly into your practice. Stay tuned to discover how these strategies can enhance your professional competence and improve patient outcomes. In this segment, we'll delve into the process of applying clinical guidelines in practice. The first step is understanding the recommendations thoroughly. This entails familiarizing yourself with the latest guidelines and the evidence supporting them. Next, it's crucial to adapt these guidelines to meet the specific needs of each patient. Remember, each patient is unique. What works for one may not necessarily work for another. Consistent implementation is the final and most important step. This involves ensuring that the guidelines are routinely integrated into everyday clinical processes. Doing so can greatly enhance patient outcomes and promote standardized care across the board. Following clinical guidelines not only helps in improving patient outcomes, but also in achieving a standardized approach to care. It reduces variability, ensures consistency, and enhances the quality of healthcare provided. Adhering to these guidelines can lead to more predictable and positive outcomes, fostering trust and confidence between patients and healthcare providers. As we move forward, you'll see practical examples of how these principles are applied in real-world scenarios. Let's delve into a practical example of integrating clinical knowledge. Dr. Smith, a dedicated cardiologist, embodies how incorporating new research can transform patient outcomes. By keeping abreast of the latest findings in hypertension management, Dr. Smith fine-tuned his approach to treating high blood pressure. He meticulously integrated current best practices into his daily routines, ensuring every patient benefited from the most recent advancements. This proactive approach didn't just change his methods, it revolutionized his patients' lives. Over time, he observed a marked improvement in blood pressure control among his patients, demonstrating the real-world impact of staying informed and adaptive. Dr. Smith's story is a testament to the power of applying clinical knowledge to practice, setting a benchmark for healthcare professionals everywhere. As we move forward, we'll explore another compelling example, this time focusing on the application of clinical guidelines in practice. In another compelling example, Nurse Johnson meticulously followed the latest diabetes management guidelines to educate her patients. By doing so, she noticed a remarkable transformation in their behavior. Patient adherence to treatment plans significantly improved. This conscious effort of applying up-to-date guidelines didn't just stop at adherence. It led to an overall improvement in glycemic control among her patients. Through her dedication and the correct application of clinical guidelines, Nurse Johnson showcased the tangible benefits that come with staying informed and proactive. Her story is a powerful demonstration of how integrating guidelines into practice can result in better patient outcomes and more consistent care. As we move forward, you'll see even more real-world applications and interactive discussions designed to deepen your understanding and enhance your clinical practice. Now, let's test your understanding with a quick quiz on clinical knowledge. Question 1. What is the primary source of clinical knowledge? Is it research studies, clinical guidelines, patient feedback, or all of the above? Take a moment to think about it. If you guessed all of the above, you're correct. Clinical knowledge is rooted in a combination of research, guidelines, and patient interactions. Let's move to question 2. Which factor is crucial for integrating clinical knowledge into practice? Is it continuous learning, patient experience, or clinical trials? You got it. Continuous learning is vital. Staying updated with the latest research ensures better patient care. For question 3, true or false? Clinical knowledge is static and does not change over time. The answer is false. Clinical knowledge evolves with ongoing research and technological advancements. How are you doing so far? As we move along, let's delve deeper into understanding guidelines and their role in clinical practice. Engage in the next segment to test your knowledge on clinical guidelines and see how well you're prepared to apply them in real-world scenarios. Next, let's test your understanding of clinical guidelines. Engaging in a quiz is a great way to reinforce what you've learned so far. Question 1. What is the main purpose of clinical guidelines? Is it A, to provide personal opinions, B, to standardize patient care, C, to replace clinical judgment, or D, to create more work for practitioners? Take a moment to think about your answer. We'll reveal the correct one shortly. Question 2. Which aspect is not typically included in clinical guidelines? Is it A, evidence-based recommendations, B, detailed implementation steps, C, personal anecdotes, or D, patient preferences? Remember, this quiz is designed to help you retain crucial information and improve your understanding. So, are you ready for the next question? Question 3. Clinical guidelines are most beneficial when they are A, ignored, B, occasionally reviewed, C, integrated into everyday practice, or D, used only in complex cases. Take your time to ponder. As we move forward, you'll see how these guidelines are applied in real-world clinical practice scenarios. Stay tuned to further enhance your knowledge and skills in providing the best patient care. As we draw this educational journey to a close, let's revisit the core insights we've shared. The synthesis of clinical knowledge and guidelines is not just theoretical, it's a practical imperative for enhancing patient outcomes. From understanding definitions to real-world applications, each segment aimed to equip you with robust strategies for incorporating these elements into your practice. We covered the intricacies of clinical knowledge, elucidated the pivotal role of guidelines, and showcased through practical examples the tangible benefits of their integration. Now, it's over to you. Stay vigilant with the latest research, embrace the guidelines designed to streamline care, and strive to implement these advancements in your daily routine. Your commitment to continual learning and practical application will pave the way for exceptional patient care. Thank you for staying with us throughout this video. Remember, the journey of knowledge is ongoing, and your dedication makes a lasting difference. As we sign off, take these insights forward and let them transform your practice. To further enhance your knowledge, stay connected with our upcoming series. Together, let's continuously improve the landscape of healthcare.